Hi, welcome. Thank you for joining us. I hope that your audio works. This is Hillary Lum, and I hope that you can see our slides. If you're not able to, these will be posted at Civic's website as they are the hosts of Colorado's MOST program. So a little bit of housekeeping. Please keep your lines muted. Please do use the chat box. If we have time, we will be able to take questions. And here's the link for where the trainings and the MOST program are located. So thanks for joining us. We really are doing this webinar in response to the Advanced Care Planning Work Group, which meets monthly on a Thursday and is open to any stakeholder. We've noticed that there is a desire for education related to the Colorado MOST form and the program. And so we also came up with these 10 things to know about the MOST, which we will go through. The original form was established as part of the National POST program in 2010 and revised in 2015. There is this National Plenary Assembly, and your representatives are Ms. Elisa Schramm as the primary member, and I, Hillary Lum, am the alternate to the National POST on behalf of Colorado. So I'm just going to jump in. I know I speak quickly, but because we want to get through a lot and hopefully take questions, we'll go quickly. So our first one, as I can advance the slides here. So the first thing, MOST is more than a form. It's a tool that translates conversations into medical orders. It's a vehicle to talk about an individual's preferences for care. So the conversation is very important. It's not a checkbox form, but instead an opportunity to engage the individual in shared decision-making, to understand what's important to them and translate that in the context of their current medical diagnoses, prognosis, and treatment options into specific medical orders. Here's an example, or here's a screenshot of our Colorado medical orders for scope of treatment. It is available at Civic's website, and notably the version from Civic does have the new website directing to Civic instead of directing to a prior website that's not kept up to date. So just reminding us that there's section A, section B, section C, and this is our current form. Point 2, MOST form is not an advance directive. This is commonly misunderstood and the terms are used interchangeably, but we want to be clear. An advance directive identifies a healthcare agent and can provide an idea or instructions about what treatments the patient would like to receive in the future. I think about these truly as the advanced care planning documents for things that we desire in the future. In contrast, MOST is a medical order set. The medical orders are immediately effective, and the MOST form should align with advance directives. So we know that we want them to be complementary. The advance directives remain in effect and valid as instructions. We certainly know that the MOST form cannot appoint the healthcare agent, and it doesn't address additional preferences that may be important to the person. So throughout these slides, I'm going to direct us also to the National POST resources, and they have a specific PDF of instructions that I've referenced here where it compares side by side in a clear chart. How is the POST different than advance directives? So see there for more information. Point 3, the MOST form is not for everyone. This is also widely misunderstood. Sometimes we'll see the MOST form being used as the first advanced care planning document for a general population. That's incorrect. The MOST form is for patients at risk for a life-threatening clinical event because they have a serious life-limiting medical condition, which may include advanced frailty. Here again, MOST in Colorado aligns with National POST in recognizing that it's primarily intended for people who may have chronic or severe illness and a limited life expectancy. here's a chart that sort of acknowledges how both advanced directives and PULSE can work together. And you'll note here that you complete a PULSE form or a MOST form after diagnosis of frailty or advanced illness, and this really could be at any age. Then, of course, it's appropriate to update the MOST form as health status changes for the ultimate goal of having treatment wishes and preferences honored. I'll remind us that the MOST is the portable order form that should cross settings with individuals. Point 4. MOST form does not have to be the original to be valid. So in particular, photocopies, fax, electronic images are valid. We do strongly encourage use of the green paper because it helps it to be easily recognizable and visualized in the refrigerator, or I've heard of some assisted living residences directing individuals to store these documents within the freezer. We also know that across all of our care settings, healthcare team members and others may not recognize the word MOST and instead will refer to this as the green paper. So that is our encouragement, to use the green paper when at all possible. Point 5, MOST form does not have to be entirely filled in to be valid. So it is okay if section A, section B, or section C is left blank. If they are blank, then the default of full treatment is assumed. As I note here. And we wanted to specifically remind us that yes to CPR must then also have yes to full treatment in section B. So these section A choices of full treatment with CPR and full treatment in section B must align. The fine print on the front of the MOST form reminds of us, and it's important that we have shared decision-making conversations with individuals so that they understand the choices they're making in choosing yes CPR and how that also necessitates full treatment. So as I'm moving through these, I'm going to remind you that if you have questions, please feel free to chat them in during this webinar. So point 6, healthcare professionals and emergency medical services must follow the MOST form. So this is why the form was designed as being portable out of hospital medical order sets that must be honored in all settings. We want these to be clear directives that can be followed in emergency or acute medical situations. So we also acknowledge that providers should follow valid MOST forms from other states as well. As an update, I'll inform us that the National PULSE, through a lot of stakeholder input, has identified a suggested form for a common standardized PULSE form, and some states are beginning to adopt that. So far in Colorado, there are not plans to adopt that, and if you have interest in learning more and providing discussion about what the implications of that would be, I encourage you to join us at our advanced care planning stakeholder meetings that happen monthly. So this point is about the fact that we need to follow these forms as healthcare providers, and if a healthcare provider considers the orders to be medically inappropriate, it's very important to discuss concerns with the patient or their appropriate legal decision maker and revise the orders after obtaining appropriate consent, engaging in voluntary shared decision making. Point 7. Doctors, advanced practice nurses, or physician assistants can sign the completed form, and others can help with the process. And by others, we're acknowledging across multiple settings that social workers and chaplains and other trained professionals are frequently involved in this process. The emphasis is on helping individuals to have conversations where they can learn more about their preferences and translating them into the medical orders. Then, to be complete, the physician advanced practice nurse or physician assistant must sign the form. Those of you who are very familiar with this will note on the back of the MOST form in the very fine print, we ask that the MOST form be signed within 30 days, and that if there isn't a provider's signature, they still be followed and not disregarded. So there is fine print to direct us in the absence of the provider signature. Related to creating the MOST form as orders, verbal orders for the MOST form can be given. I think this is especially relevant in the context of assisted living residences or nursing care facilities. So we recognize that verbal orders can be given in terms of trying to facilitate the individual's care. Point 9. MOST form should be reviewed routinely and changed as appropriate. This again was noted on that flow diagram that reminds us that with change in condition or new diagnosis or new information or the person's preference, we should engage in conversations and update these forms. Updating is always voluntary and again should be done in consultation with healthcare team members who know information about different treatment options and the likelihood of those being aligned with the person's overall preferences. And point 10, residents are not required to complete a MOST form for an assisted living residence or nursing home. I think across the US and also in some settings here in Colorado, this is misunderstood. So we want to be clear. Assisted living facility, a residence, or a nursing home cannot require the MOST form. It's always voluntary. A new MOST form also is not required if a resident moves into a new care setting. We should be honoring, as noted in one of the previous bullets, a current accurate MOST form. We don't need to have them complete a new form. And so that's getting us through these 10 points. And I see that there is a question, so I'll go back up to number 5, and I encourage all of us, now that you've sort of seen a very quick, I recognize, overview of 10 points that we wanted to acknowledge and increase awareness of here in Colorado. I hope others of you have questions as well. So I'm going to go back up to point 5, where the MOST form does not have to be entirely filled in to be valid. And I see a question from Claire. I'll just read it in case you can't see the chat. If someone indicates yes CPR, then full treatment, which is required, but does not want to be on life-sustaining treatment for an extensive period of time, is this when they could write additional specific instructions on the additional orders line? For example, all life-sustaining measures should be removed after 7 days if no improvement occurs. I think that is a very appropriate use of the additional orders line. And that's often what I'll talk about with individuals and my patients as we're discussing this. If they want a trial of CPR, they'll mark yes CPR, and then that results in choosing full treatment in section B, and I'll counsel that it's then very important to ensure that your preferences and goals are known to your surrogate medical decision maker, who serves as your voice and your advocate, who could verbally say, you know, that after a time, if my goals are not being met, I would not want life-sustaining measures to be continued. Secondly, as noted here, the additional orders help inform medical care. And of course, advanced directives may be appropriate in helping to provide instructions in this situation. So that's also where a MOST form doesn't need to have all of the information, and the healthcare agent should also be very familiar with any preferences and instructions within the living will. So thanks for that question. Happy to have any other questions. And I know that there are others on the webinar who are part of our advanced care planning stakeholder group. And so maybe while people are typing in questions, Kari, would you be willing to introduce yourself?
Hi, Hillary. Thank you so much for doing this, and thank you to everyone who is joining. My name is Kari Degernes, and I help lead the Advanced Care Planning Work Group. I will be sending an email out afterwards with some follow-up from today, including the PULSE resources, as well as information on getting involved with the Advanced Care Planning Work Group. And so our contact information will be in the slides, and as soon as the recording is available, I'll share that out and get it on to the website, but we'll include the PowerPoints and the slides so you can find our contact information afterwards.
Thanks, Kari. And I believe Elisa Schramm is also in the room with you. And if she is, Elisa, can you introduce yourself and sort of give your perspective on these top 10 things to know as you see them either used appropriately or inappropriately here in our Colorado community?
Yes, thank you, Hillary. This is Elisa Schramm. I'm a geriatric care manager. I've been involved with the MOST program almost since it passed the legislature and was adopted 2010. We reached out to many people in the community to get their perspectives on misunderstandings about the MOST form, and I think they're captured very aptly here. It is very important that people are aware of the legislation and are following it appropriately. And we welcome any questions people have, either coming to our monthly meetings or sending an email, and we'll get right back to you if you have any specific questions about using the MOST.
Thanks, and maybe I'll reach out, Mindy Rickard, and put you on the spot because I recognize your name. Mindy, I wonder if you participated in an event that happened this morning, and if you would, since we have a group of stakeholders on the line, if you could give an update for this community.
Oh, thank you, Hillary. I'd be glad to do that. My name's Mindy Rickard. I'm the project coordinator for the Larimer Advanced Care Planning team. And we did have a stakeholders meeting this morning to talk about the MOST form and to really talk about what our challenges are out in the field. And we did have representatives from EMS, which was great, along with providers, the palliative care team up here in Northern Colorado with UC Health. And our challenges are, they were very impressed, and thank you for letting us share this PowerPoint with the group. They liked the fact that it was so concise, and it did help answer a lot of questions for them, and some of them may be on the line today. The challenges are just that education piece to providers, to EMS. And one of the things that I found, I actually was working with some older adults yesterday in a church setting, and we ended up having quite a robust discussion about the MOST form and CPR in particular. And there is that lack of understanding when it comes to the MOST form and what it means and who it's appropriate for. So I want to say that this was extremely helpful. I think you captured it in a very concise way, and I think we'll be using it as we move forward with training for every level of caregiver.
Thanks, Mindy, for that update. And in me being the academician that I am, I continue to update the PowerPoint. So I will send this again to you with its updates, and we will make
Thanks,
sure
I
that,
noticed that.
and we will
Because
make
we'd
sure
love
that
to put it on our website as well. So.
yeah, we'll make sure the updated PDF is also on Civic, and any of you are welcome to distribute it. It's of course dated, so we will, you know, as potentially statute changes, things always need to be updated. So I'll also reference Robin's question in case you're not able to see everything. She asked, can hospices require a MOST form? So no, they can't. Just like we said that assisted living residences and nursing homes cannot require a MOST, hospices cannot either. And I think that is a common misconception. You know, there can be the assumption that you have to be do not attempt resuscitate to be in a hospice program. And that's of course a separate conversation, but as a practitioner, I see it as similar in that these truly are patient choices. Patients have autonomy, and therefore they can choose to participate in these conversations, and then they can also choose the preferences that are aligned with their individual values. So we have about 5 more minutes. Any other questions? And you're welcome to, I'll give a pause, and if you want to unmute yourself or speak out your question, happy to take them verbally too. I have a question in that obviously we can't cover all of the education in a very brief 10 things to know about MOST. So for any of you on the call, would you be willing to share any challenges that you are currently facing, similar to what Mindy just shared of challenges that she has in her area? So be thinking about that, and I will answer Ashley's question. Thanks for writing it in. So the Colorado MOST specifies age 18 and over, whereas the other national PULSE forms don't specify an age. Thank you for making that distinction. It didn't make our top 10, and you are absolutely correct. So in Colorado, the law is 18 and older. There are historic reasons for that, which I won't get into. What I will say is if you have interest in ongoing discussions, there are some stakeholders here in Colorado that would like to create a children MOST or a pediatric MOST. So we aren't thinking that we would open up the legislation that directs this particular Colorado MOST, and we see the value of this type of portable medical order set that can be helpful for individuals who are younger than 18. So if you'd like more information about that, please do reach out to me, and my information is at the end of the PowerPoint slides. And so I'll see if I can have us land on this. So for anyone who's interested in a stakeholder group specific to potentially drafting new legislation for a pediatric Colorado MOST, I know of others who are interested. So happy to hear from anyone about other educational needs or challenges you see in the community that maybe our advanced care planning work group in partnership with Civic would be able to host future webinars or future panel discussions or conferences about. One final, since I have you as a captive audience, you haven't left yet, I will share, as you may know, Colorado passed legislation to create an advanced care planning document registry, and that effort is being led by the Colorado Department of Public Health and Education, or Environment, in collaboration with our health information exchanges. And it's another plug to be on our advanced care planning stakeholder email distribution list and to share that with others. But I encourage you to complete a recent survey that Kari sent out. And if you didn't receive that survey, to email Kari to ask for it, because CDPHE is looking for stakeholder feedback on how a registry could be most helpful for those of us who are hopefully the end users of such a registry. And the deadline for survey completion is December 2nd. So another thing to follow up with Kari related to this topic. And Kari, do you have any closing thoughts?
No, just want to thank everyone, and I've made some notes, and I will send out some follow-up information, and don't hesitate to reach out to any one of us. We're pretty responsive and happy to answer questions, and really want to make sure that this is extended out to folks. So make sure to share the links out and just send people our way if they have any questions.
Yes, I'll echo that. Thanks for participating, and certainly on these resources, there are many good things, both Colorado locally at Civic's website, as well as the National Post, including many downloadable, very straightforward one-page information sheets. I highly recommend it. And today we really made effort to align with National Post, as Colorado is part of this national program. And we are really excited that when Kari pulled some statistics, people are finding the Colorado Most page. There have been almost 5,000 page views, and people are also emailing their questions into Kari, who then connects with the most appropriate person to help provide the resource or information on the question that the person has. So with that, we will close. Thank you all for joining, and have a great Monday.